Today I will be explaining the long answer question of microbiology. So the question that the examiner asks is, describe the morphology, cultural characteristics and pathogenesis of Corynebacterium diphtheriae and give detailed laboratory diagnosis of diphtheria. So we'll try to simplify the answer as much as possible. We'll start the answer by giving the morphology characteristics of the bacteria. So Corynebacterium diphtheria gram-positive, non-acid fast, non-sporing, non-motile bacilli. They are bacilli, which is important. They frequently show club-shaped swelling. Corny means club-shaped. C. diphtheria causes the diphtheria in humans. So that is the most common form of the Corynebacterium, that is the C. diphtheria. Then write the morphology. So in the morphology, they are thin, slender, gram-positive bacilli and write its size. They are pleomorphic. They are club-shaped due to the presence of metachromatic granules at one or both ends. With Loeffler's serum, methylene blue strain, granules take a bluish purple color and hence they are named as metachromatic granules. So in the morphology, you have to mention why they are called as metachromatic granules and why do they get that name. Then these granules are also called as volutine or Babe's own granules. Then mention all the features, that is they have a Chinese letter for arrangement, they resemble letters V or L. The bacilli look green and metachromatic granules appear bluish black when Albert stain is used. So when there is Albert stain used, the bacilli look green and the metachromatic granules appear bluish black. This is also an important point that you need to mention. Then we move on to the cultural characteristics of the Corynebacterium diphtheriae. They are aerobic and facultatively anaerobic. The optimum temperature for growth is 37 degrees Celsius and the range is from 15 to 40 degrees Celsius and the optimum pH is 7.2. Then you will write the different media that are employed for cultivation of the bacillus. So first is his serum water. In the serum water, the growth is seen as a turbidity and pellicil formation is seen. Next is Loeffler's serum slope. In the Loeffler's serum slope, the bacilli colonies they appear after 6 to 8 hours of incubation, long before other bacteria grow. And the colonies are small, circular, white or creamy. So in the cultivation methods, first is his serum slope in which you will write the growth is seen as turbidity and pellicil formation. Next is the Loeffler's serum slope. Colonies appear after 6 to 8 hours and you have to mention what type of colonies are seen. Next is the telluride blood agar. It contains potassium telluride, that is 0.04% of potassium telluride, which inhibits most of the bacteria. So the Corynebacterium diphtheriae, they form grey or black colonies due to the reduction of the potassium telluride to tellurium. The colonies may take 2 days to appear on this medium, and based on the colony morphology on the telluride medium, they are divided into 3 main biotypes, that is the diphtheriae, gravis, intermedius, as it's 3 different types. Next is the biochemical reaction. So they ferment glucose and maltose with the production of acid without gas. They do not ferment lactose, mannitol or sucrose, that is the C. diphtheria. They ferment glucose and maltose but they do not ferment lactose, mannitol or sucrose. This is the only point that you will need to mention in the biochemical reaction. Next is their toxins. The toxigenicity of the diphtheria bacillus depends on the presence of a tox gene, TOX. It is a very important thing that you need to write, tox gene, which can be transferred from one bacterium to another by a lysogenic bacteriophages, of which beta phage is the most important. So in their toxigenicity, you have to write it depends on the presence of tox gene. That is the first point. Next point is that it can be transferred from one bacterium to another by lysogenic bacteriophage, out of which it is a beta bacteriophage. Non-toxigenic strains may be rendered toxigenic by infecting them with beta phage. So if it is a non-toxigenic, it can become toxigenic if you infect it with a beta phage. This process is known as lysogenic or phage conversion. So that is it. You have to mention only these terms in the toxigenicity. So you will start your answer first by giving the morphology, on which mediums the Corynebacterium diphtheria grows, then about its biochemical reactions and the toxigenicity. No need to write this table or draw this table as it is not required. Next, we'll move with the properties. So the diphtheria toxin is a protein. So properties of the protein, and it has a molecular weight of about 62,000. It consists of two fragments, A and B. The molecular weight of fragment A is 24,000 and that of fragment B it is 38,000 respectively. This is the only point that you need to write in the properties of the toxin. Then comes the mode of action. This is very important. So how does the toxin spreads? It acts by inhibiting protein synthesis. It inhibits polypeptide chain elongation in the presence of NAD by inactivating the elongation factor, that is EF2. You have to write this complete mode of action. Next comes the resistance. It readily dies when exposed to a temperature of 58 degrees Celsius for 10 minutes or 100 degrees Celsius for 1 minute. It is resistant to drying. So in the resistance, it will die if the temperature is about 58 degrees Celsius. Next comes to the pathogenesis. Diphtheria may be one of the following clinical types depending upon the site of infection. There are 7 different types on which the diphtheria toxin may be spread. First is the faucial, followed by laryngeal, nasal, conjunctival, otitic, vulvovaginal, and cutaneous, mainly around mouth and nose. So the diphtherial toxin, it has got both local as well as systemic effects. So what are the local effects? The bacilli may remain confined to the site of entry. That is usually it is upper respiratory tract infection where they multiply and start producing toxin. The toxin causes local necrotic changes along with superficial inflammatory reaction. The necrosed epithelium together with the fibrinous exudate, leukocytes, erythrocytes and bacteria constitute the pseudomembrane, which is a characteristic feature of the diphtheritic infection. The mechanical complications of diphtheria are due to pseudomembrane, whereas the systemic effects are due to toxin. So, the mechanical complications of the diphtheria are due to the pseudomembrane, systemic are due to the toxin. This is an important point that you need to mention. So, in the local effects, you have to write about the pseudomembrane formation. Next comes the systemic effects. The diphtheria toxin diffuses into the bloodstream and causes toxemia. The toxin has got affinity for cardiac muscle, adrenals and nerve endings. It acts systemically on the cells of these tissues. So this is about the pathogenesis. So in the properties of the toxin, first we will mention about the two fragments A and B, then the mode of action, its resistance and pathogenesis. How is the toxin spread? By 7 different ways. And then about the effects, that is a local effect, systemic effect. So with this we complete the mode of the toxin spread of the diphtheria. Next we move on to the laboratory diagnosis. So how do we confirm that there is diphtheria present? So first, for the laboratory diagnosis, it consists of isolation of the organism and demonstration of its toxicity by the virulence test. So how do you isolate the organism? First is the collection of the specimen. 2 swabs from the lesion, that is throat, nose, larynx, ear, conjunctiva, vagina or skin are collected. On one swab, it is used for smear examination and other is used for culture. So we will collect 2 different specimens. One is used for smear examination and other is used for culture. Local lesion is usually in the throat. Swabs are collected prior to the start of antibiotics and application of antiseptics in the form of gargles. These swabs are then rubbed over the affected area and a pseudomembrane, if formed, should be scraped with swab. If there is no definite localized lesion, these swabs should be rubbed over tonsils and the posterior pharyngeal wall without touching the mouth part. So that is how you isolate and you collect the specimen. Next is, after collection of the specimen, you view the specimen under direct microscopy. In this, what happens? The smears are stained with both Gram and the Albert stain. We had read about the Albert stain in the morphology in the start of the answer. Diphtheria bacilli show beaded, slender, green rods in typical Chinese letter pattern on Albert staining. However, they cannot be confidently differentiated from some other Corynebacterium organisms that are present in the throat. Hence, it is reported as the organisms resembling C. diphtheriae seen in the direct smear examination. Then we move on to the culture. The swabs are inoculated on the following culture medium. We had learned about these culture medium earlier. First is the Loeffler's serum slope. Again, the growth appears within 6 to 8 hours on this medium. Subculture from Loeffler's serum slope is made on telluride blood agar and the plate is incubated at 37 degrees Celsius for 48 hours. Next is the telluride blood agar. The plates have to be incubated at 37 degrees Celsius for at least 48 hours before declaring these as negative, as growth may sometimes be delayed. Next is the blood agar. It is useful for differentiating streptococcal or staphylococcal pharyngitis, which may simulate diphtheria. So after collection of the specimen, you view it under direct microscopy, then we do the culture. So in the culture, you have to write about 3 different culture mediums: low flow serum slow, telluride blood agar, and next is a normal blood agar. Then comes colony morphology and staining. In this part, you can write the initially what we had learned about the telluride blood agar and the Chinese letter pattern. Next is the virulence test. So virulence testing may be done in vivo or through in vitro methods. In vivo test, guinea pigs and rabbits are susceptible to toxin that are produced by C. diphtheriae. Two types of tests are used: subcutaneous and intracutaneous. In the subcutaneous test, you have to mention that the growth from an overnight culture on the low flow serum slope is emulsified in 2 to 5 ml broth, and 0.8 ml of this emulsification is injected subcutaneously into 2 guinea pigs. So from the low flow serum slope, 2 to 5 ml of the broth and 0.8 ml of this emulsion is injected into 2 guinea pigs, one which has received an intramuscular injection of the diphtheria antitoxin and another which has not, that is, this acts as a control animal. If the strain is virulent, the unprotected animal will die within 2 to 3 days. Then you can mention about what other features are seen in the autopsy. That is the edema, swollen and congested lymph nodes, and many other features. So you can go through these features and write. Next is the intracutaneous test. So in this test, 2 guinea pigs or rabbits are injected intracutaneously with 0.1 ml emulsion from growth on low flow serum slope. In your subcutaneous, it was 0.8, but in your intracutaneous, it is 0.1 ml emulsion. And one of the animals is protected again with the antitoxin the previous day, and the control animal is given only 50 units of antitoxin, whereas the another animal, it is given 500 units of your antitoxin. And the antitoxin is injected intraperitoneally before 4 hours after the skin test. So in this, what are the results? If the strain is toxigenic, the inflammatory reaction at the site of injection progresses to necrosis in 40 to 72 hours in the test animal, but there is no change in the control animal. So these are the 2 different types of tests. Now we move on to the in vitro test. So those were the in vivo. In the in vitro test, it is the Elek gel precipitation test. To know this test better, you can go for my MCQ video of the Elek gel precipitation test. I have explained the whole test in detail in that MCQ video. So you can refer that. I will be uploading the links in the description. The next is the prophylaxis. The prophylaxis consists of active immunization. So in the active immunization, and is started 6 weeks of age by a toxoid in combination with the tetanus toxoid and pertussis vaccine, that is DPT, which is called as a triple vaccine. 3 doses of 0.5 ml each are given by intramuscular route at an interval of 4 to 6 weeks, and then a booster dose is given. Next is passive immunization. It is only used in cases of emergency measures, when susceptible persons are exposed to infection, as when a case of diphtheria is admitted to pediatric wards. In such cases, 500 to 1000 units of antitoxin is given. Next is a combined immunization. All persons receiving antidiphtheric serum, that is ADS, as prophylactic measure should receive combined immunization. In the combined immunization, you have to mention that a precipitate like alum precipitate is used, and it should be preferred for combined immunization, as plain formal toxoid responses is unsatisfactory. So sometimes in a small answer question, they ask you about the Schick test, but nowadays this test is not used. So if they ask you in your small answer questions, you can first write the method of how the Schick test is performed. Then after the method, there are the results. So results, there are 4 different types of results. One is positive reaction, negative reaction, pseudo reaction, and a combined reaction. And then you have to mention that the results are read after 1, 4 and 7 days. Do go through all the highlighted points of each and every result and mention them in your answers. And then we move on to the last point, that is the treatment. So C. diphtheria is sensitive to penicillin, erythromycin and other antibiotics. With this, we complete our today's long answer question on diphtheria. So you will be starting your answer with the morphology of the diphtheria, draw the diagram, then write all the different methods, that is a Loeffler serum slope, his method, blood tellurite agar, his serum water for the cultivation. After the cultivation is done, you go ahead with the toxin. So in the toxins, first you will write what are the different types of the toxin, the pathogenesis, properties, resistance of the toxin, and how does the toxin spread and what effects, that is the local and the systemic effects it causes. Then we move on to the laboratory diagnosis, that is done first by isolation of the organism, that is you collect the specimen, we view it under direct microscopy and again write the different types of the culture media. Next is the in vivo and the in vitro test. In the in vivo test, that it again consists of the subcutaneous test and the intracutaneous test, and your in vitro is your Elek gel precipitation test. Kindly draw the diagram in case of Elek gel precipitation test. Last is the prophylaxis and consists of active immunization, passive immunization and a combined immunization. Last, you can write the treatment. No need to write the Schick test in your answer, in a long answer question. I have explained it today as sometimes they can ask you in your small answer questions. With this, we complete the answer. Thank you. Do subscribe and share with your friends.